This is Science Friday. I'm Ira Flato. A visit to the hospital can be a stressful experience, right? There is, of course, the health condition that brought you there, but it can be a challenge to communicate and receive information clearly with a constantly changing staff of nurses and doctors. Now, I want you to imagine that experience while deaf. Yes, many deaf patients report never getting an interpreter and being misdiagnosed and mistreated as a result, even though the Americans with Disabilities Act mandates that deaf patients receive interpreter assistance. But the good news is that one hospital is changing its approach to caring for deaf patients by listening to what they need. In 2022, the University of Utah Health convened a panel made up of deaf patients who advised the hospital about how it can best care for them. And joining me to talk today about the program are my guests, Dr. Michelle Lichman, Medical Director of Intensive Diabetes Education and Support Program at the University of Utah, and Tamiko Rafiq, a member of the group Deaf Diabetes Can Together. Welcome both of you to Science Friday.
Thanks for having me here. I appreciate it.
Thank
Nice
you.
to have you. And just to note, to say again that this event was recorded as part of a live Zoom call-in, and you will hear Tamiko's words through an interpreter who will also be interpreting for deaf and hard of hearing people who will ask questions throughout our chat throughout the interview. And I promise you, this is going to be really very interesting. Let me get right to my first question. Tamiko, can you tell us about the experience you had when you were diagnosed with diabetes in the hospital?
Sure. So it happened that I was in the hospital because I was feeling very, very ill. I went in and let them know, I said, hey, I am going to need an interpreter. And they said, okay, we're going to look for one, but they brought in a VRI, video relay interpreter. So this is called VRI. It's called Video Relay Interpreter. And what that is, it's a device on a screen, sort of like an iPad. And I said, no, I would prefer an in-person interpreter. And they said, okay, well, we'll find someone later, and when the doctor can make his rounds and we'll provide you an interpreter. And I said, okay. But I was very, very sick that day. I was just feeling so unwell. We were riding back and forth. The communication was failing. And, I was in the hospital just waiting and waiting. Nurses were coming in, trying to talk to me, and I wasn't understanding. They were listening to my heart. I was trying to tell them how I was feeling. I was very, very pale. And again, here I am just waiting for an interpreter, and they keep bringing this iPad to me. And my daughter was sitting with me at that time. She was about between 8 or 10 years old, and they wanted her to interpret. And I said, no, she's too young. This is my daughter. She shouldn't be interpreting for me. So they're trying to, ask me what's wrong. And they ended up sending my daughter home. And I said to send my daughter home. And I said, how? I'm a single mother. They're telling me I needed to stay in the hospital. Again, communication was just failing, and I had no idea what was going on. So they were able to take my daughter home. We were able to call a friend and my sister-in-law, who were able to come get my daughter. And then I was left alone in the hospital. And there was a moment that I felt like, I need access for communication. I need to be able to talk to the doctor and the nurses that are coming in and out of my room. And it just wasn't happening. I felt so terrible. It feels like my whole world was crashing in. I didn't know what was wrong with me. I didn't know if it was a heart problem. They kept taking my blood pressure and doing all these tests, and they're telling me I need to stay 2 nights in the hospital. And no one let me know why. No one ever told me what was wrong. And then it was not until I finally got out of the hospital and I was reading my discharge papers that I realized I was diagnosed with diabetes. And I had no idea what that even meant. I didn't know who to contact. I live here in Tucson, Arizona, and there was really no information specifically for deaf people. So I couldn't find out how I needed to approach this situation. I didn't really know what diabetes was. And it was a terrible experience. I had to ask my family members, what do I do? Where do I go from here? And they didn't know. So became a big problem. And it still is a big problem in the US for deaf people.
Wow, that was an awful experience, Tamiko, I feel. We feel for you. Thank you for relating that to us. Michelle, you study diabetes. Can you tell us more about the link between that and deafness?
Sure. So deaf people can get type 1 or type 2 diabetes, but there's also other conditions, one being maternally inherited deafness and diabetes, where they're linked. You get kind of this double whammy where you experience being deaf and also experience having diabetes. And that diabetes most often acts like type 1, where you require insulin. And so there's a higher incidence of diabetes just because of that reason. But I want to also add that there's a higher incidence of diabetes because there's a lack of information access. Tamika described it really well with her own experience. But when you don't have access to information, it's really hard to know what you need to do to maybe prevent diabetes or decrease your risk for diabetes. That's quite problematic.
Very interesting. Michelle, you're a CODA, CODA, a child of deaf adults, and now you research diabetes. What was your experience like watching and helping family members trying to navigate the healthcare system? We heard about what Tamika went through.
Yeah, so I grew up interpreting occasionally for my deaf mom when my dad was at work. And, being 8 or 9, that's a challenging experience because you don't always understand everything that is being said in the clinical setting. And I'll add that a few years ago, my aunt was in the hospital in Nevada, and she went in for an infection and asked for an interpreter. She was advocating for herself, and the hospital told her, we're only going to provide an interpreter when the doctor comes in and makes their rounds. And the thing is that when you're a patient in the hospital, you need to communicate with lots of people. And there was an instance where she was going like this, and the nurse actually wasn't quite interpreting that correctly. She brought in some water, she brought in a blanket. And then finally, I had another aunt walk in the door who was hearing and said, you know what, she's trying to tell you that she can't breathe. You need to get on this. And she actually died later on in that hospitalization. And we just know that it could have been prevented. We knew that had she had an interpreter that full time, there could have been something done more immediately to help her situation. And it shouldn't be the reliance on family members, because not everybody has family members that are able to be in the hospital with you to be those interpreters, and nor should they have to be the interpreters. There's a law, as you mentioned earlier, that requires that interpreters be provided if it's requested.
Yeah, that's a terrible experience to recount. Thank you for helping us understand it. And as you say, and as I said earlier, the ADA requires that hospitals provide interpreters for deaf patients, but they often fail at doing this. Can you tell us why that is?
Yeah, so the statistic is 50% of the time when an interpreter is requested by a deaf individual, it's not provided. That's half of the time. My experience with my own family members has been that they don't know how to schedule an interpreter, or they are concerned about the expense, or they try to push it on a family member. Can you just bring someone with you and your family to do the interpreting? Maybe it's that they're not familiar with the law, but they're definitely not educated to the point where they know how to handle working with the deaf community.
Wow, that's amazing. I know, Michelle, you and others helped form the Deaf Community Advisory Board. Sounds really interesting and important. Tell all of us what the goal was here.
So one of the things that's really important is that we don't build things for people without their input. And so we wanted a Deaf Community Advisory Board that was national, because we know that there can be regional signs and different experiences across the United States. So our community board is all over the country, from California to Texas to Maryland to Wisconsin. And really the goal was for them to guide us in developing a diabetes education intervention that would work for them. And so what we did is we sat together over 10 meetings in 7 months, and they really described what that program would need to look like for it to be effective for them. And so it was really deaf-led the entire time, and then us figuring out, well, how can we make sure that those pieces get put together? And then we'd go back with what we had built, and they would give us feedback, this works or this doesn't. And Tamika was a part of that board, who was so critical in making sure that we knew how to build something.
Yeah, I want to get, excuse me, I want to ask Tamiko about that. But first, I want to make clear that you also partnered with an advocacy group called Deaf Diabetes Can Together, right? And you formed this board by reaching out to, as you say, the Deaf Diabetes group online.
So let me clarify that a little bit. So Deaf Diabetes Can Together is the board that worked with us. And so after being together for so many meetings, we came together and they became the board, and they're advising not just on this intervention, but on so many other projects as well. They're guiding us on, look, I should back up. They have guided us on how to create an ASL glossary of diabetes terms, because not all diabetes terms are signed the same regionally, and some could be clarified to convey the point a little bit more clearly. They've also guided us on how to set up an ASL interpreter training regarding diabetes terminology.
I'm glad you clarified that, and you've added very important information, because I want to ask Tamiko about that, because I understand, Tamiko, you were part of this board. What were the sorts of things that you and the others suggested the hospital implement? Because you should know better than anybody else.
Yes. So first, let me back up a little bit. The deaf group, we developed, like Michelle already had said, we developed an ASL glossary, and, you know, not just with ASL terms, but we modified and helped design the program and what it looks like, because some deaf people do have visual problems as well. So we tried to accommodate all people within the deaf community, those who may have low vision and things like that. So that's where we really came in and helped to make sure we were fitting everyone's needs and making everything as accessible as possible. And, you know, you may look on your phone and be able to click on a video and then understand what a term is. And that could be really, really helpful for some deaf people, because some deaf people have various degrees of English proficiency. So, and that varies across the country. So we wanted to make videos that were very clear and that could educate all people. And like we said, we made this board, this CAB, this community advisory board, and, you know, like we gave them our input, and like Michelle said, they developed some of the things and then would bring it back to us. And so Deaf Diabetes Can Together is really amazing. We've worked so well as a team. Honestly, we've become a family. We're supporting each other. We all have similar experiences. We're learning from each other, and we're learning, you know, how we can really improve access for all deaf people all over the US. And so I hope internationally as well someday. For now, we're focusing on the US, but we're hoping that could be something in the future. And, you know, and we realize that deaf need the education and they need the access to that education. And so we are just so happy to be part of that group. And, you know, giving access to language, access to education, and everything. So we're really trying to focus on all of that right now, and that's what we've been doing so far.
That's great to hear. I just want to remind our Zoom viewers and listeners that I'm going to be taking questions from you folks out there, and if you got them, please post them up on our board, and I'll either get to you asking it, or if you're a little shy or you don't want to ask your own question, I'm happy to ask your question for you. So we'll get to those in just a few minutes. Now, Michelle, I understand that you want to set up programs at the University of Utah Health for other communities, not just the deaf community. Tell me why you'd like to do that.
Well, so we know that whenever there's a language difference or a cultural difference, that it can actually impact the education that someone receives. And sometimes a misdiagnosis can even happen. And so one of the things that we have worked on is providing this program in Spanish language, and we've done that for rural communities by telehealth in Colorado. And we're also in the process of setting this up for a Pacific Islander Native Hawaiian community as well.
Well, and how far along are you with this? And do you need help on getting this going?
Yeah, so the Spanish program has already been set up. I think what we're trying to do is figure out how to implement it further within Utah. And then the Native Hawaiian Pacific Islander program is being actively set up by a PhD student that's working with me and the rest of our team. And so that should be hopefully coming through sometime next year.
And so those are some of the next steps and big dreams for this program. Tomiko, tell us what you would like to see. What are your next steps and big dreams for this program?
So my vision for this program is I just want to change the healthcare system. We want to really promote education within the staff and the medical doctors and nurses about what it means to provide interpreter services. Honestly, that is one of the biggest pieces is we need interpreters in healthcare, and to let them know that we don't like the VRI, the video relay interpreters on the iPads. You know, it's not the best option. It's not always successful. And the reason behind that is it's just, you know, there a lot of times the Wi-Fi is not very clear. It's there's a lot of lag time, and when you're in an emergency, it's impossible to be able to set up this iPad and call an interpreter when you have a deaf patient who's in real distress. It's just not successful for us as deaf patients. We want live interpreters, and also we want this nursing staff and doctor staff to be aware that we don't really like the VRI system. It takes too much time from our appointments, and it's not successful. The other thing is with that video relay interpreters, it's hard because there are many deaf people who are not familiar with VRI. They may not know how to use it. A lot of deaf people are not comfortable. They really would prefer that connection with an in-person interpreter, because there's a lot more understanding. And also we need more interpreters who are familiar with those health terminology, you know, such as insulin pumps, these signs right here. A lot of interpreters are not actually aware of that. So we need some more specialty training programs. So, and then also CDIs. CDI stands for Certified Deaf Interpreter. So those are deaf people who are very, very skilled with their own language, and they know how to talk to deaf people who maybe have different language needs. So occasionally CDIs will be paired with hearing interpreters to really make sure that the deaf patient is understanding everything, and that they're receiving the information in the language that they prefer and that they use. So we really want to encourage healthcare systems to please hire more interpreters, in-person interpreters for all deaf patients. So that's really my hope and dream. And I would love to see more of that, just awareness and the ability to provide interpreters. And, you know, just to have interpreters, to have that compassion, to have the understanding, and to help deaf patients really understand their healthcare needs. I think it will prevent a lot of issues and just help educate deaf people for the future.
One question about this, and let me bring this to you, Michelle. Are there enough interpreters around? Tomiko says, let's hire more of them, but could you find them if you wanted to?
Yeah, it's a great question. So one of the things that happened during the pandemic is some interpreters changed their job and they weren't interpreters anymore. And then the second thing that happened was, because we were in virtual environments, some interpreters decided that they would only do virtual appointments. And as you heard from Tomiko, many deaf people prefer in-person appointments. And so there's this kind of challenge of trying to find someone who will actually physically come on location. And so, yes, we do need more interpreters that will interpret for ASL. Absolutely.
Mm-hmm. And Tomiko, going through this whole process, how did it make you feel? How does it make you feel now?
Well, I mean, that was a huge challenge in my life. For example, with the VRI, the iPad interpreter, it's a lot harder for me to understand because the doctor is sitting down, he's explaining, like, for example, he's explaining what a glucose meter is and how to use it. But then, he's trying to show me something, and then I'm trying to look at the screen to see what the interpreter's saying. So I'm looking back and forth, and it was just very, very difficult for me to keep track of what the doctor was saying and what the interpreter was saying because I couldn't see what the doctor was holding up. So that's just one example of the virtual interpreters just not being good enough. And also, if you're teaching a deaf patient how to use an insulin pump, and it's physically touching your body, but then you're looking at a screen, it's just very, very difficult. And again, that's where we need to educate healthcare staff, nurses, and doctors, and just let them know that VRI is not a great fit for us deaf patients.
Well, now that you're an advisor, do you think that there's going to be real progress being made? And this program, the wheel has started to turn a bit. Maybe progress will happen. Do you feel confident you're going to see a change?
I do feel confident. I'm very hopeful that we're going to see some improvement with what the Deaf Diabetes Can Together group is creating. And our goal is to make that happen. So we wanted just to encourage more partnership within the healthcare community. And I think that we will improve it. We will be successful. It's a lot of work, but we can do it.
Okay, thank you both. We've had some really good foundation to understand what's happening. And now we have some great questions coming in from our Zoom audience. Jessica has a question about being the best advocate for patients. Jessica, go ahead and ask your question.
Yeah, thank you so much for taking my question and for being here. I am an RN at my local hospital in Northern California, and I really appreciate everyone sharing these eye-opening perspectives and experiences. And I'm just wondering what advice you might have for me on being a better patient advocate, specifically what like laws and policies, et cetera, I could reference while advocating to have a stronger, impact to the powers that be.
Laws and policies. That's something we hadn't gotten to, which to me says money. If you talk about laws and policies, someone's going to have to pay for it. And Michelle, let me ask you, is the state, you're in Utah, has the state shown any interest in helping you fund to get the things that you need?
Yeah, so far we've been talking to individuals on the Hill about legislative appropriations to support the ASL interpreter training. So that would happen in Utah. So that's something that we're very hopeful for that moving forward. The question that was asked, and I'm so glad that you're an RN because we actually need more nursing staff advocating for deaf individuals. So one thing that we saw in some of the research that we did is that in some instances, clinical staff actually have more power in advocating than deaf individuals, which is absolutely sad and ridiculous because deaf people should be able to say, I need an interpreter. And then the American Disabilities Act says they've requested an interpreter and they should be able to receive one. But we noticed that when a nursing we noticed when someone from the nursing field or other medical field actually stepped up and said, we need this interpreter, we need them in person, that the healthcare system was more likely to listen. And so it's really important to advocate for your patient on what they want. And then on the flip side, we need systems to listen to deaf people.
When you say systems, what do you mean by that?
I mean healthcare systems. So whoever is running the show within different healthcare systems, we need to make sure that they have language services in place so that they can make sure that they're provided to deaf individuals. In my own state, I live here in Utah. My mom requested an interpreter just a few weeks ago, and she waited while the front desk person was trying to figure out what to do. And that front desk person, talked to the physician there and then came back on the call with my mom and said, you know what, the doctor just wishes you would go somewhere else. And that's absolutely ridiculous and unacceptable. We should not be deciding who gets care where. And so
Right.
it's really important for deaf people to be able to get the care that they need. And that ADA law is in place and it needs to be followed.
Tomiko, you've been through this. What do you tell our RN who has asked these questions about being a patient advocate? What laws and policies or how to get something done?
Yeah, so with my experience with, like I said, my daughter, she's a CODA as well, the nurse will try to ask my daughter a question and I'll interrupt and say, excuse me, the ADA law requires you to follow, my requests, and you cannot use my daughter or brother or sister or family member to be an interpreter. So I say, I need, and occasionally they'll try to fight that. And I'll say, no, this is the law. You cannot ask a family member or friend to interpret for your deaf patient. So I just wish maybe that there was sort of a brochure or something small with the ADA law on it that had the rules very clearly, that we could show healthcare providers, just something very, very simple that is easy to use, easy to read, that we could show them and say, actually, you need to follow this law and I require an interpreter, so that the nurse and the doctor could look at that and understand what my need is, and that they understand that they have an obligation to follow that.
Very interesting.
So,
Maybe you
and
could.
sometimes, oh, I'm sorry about that. And sometimes, with health insurance, that comes into play as well. Sometimes health insurance can be the key for all of that. Is sometimes it's a struggle whether the health insurance wants to pay for the interpreter or the hospital has to pay for the interpreter, and then you get the runaround. So it's ridiculous. They try to fight on who is responsible for paying for the interpreter. So if we could figure out how those two systems could interact. Sometimes health insurance do provide an interpreter, but they say only a VRI. We cannot provide a live interpreter, or there's no live interpreters available. So again, there's just all these different, hoops that you have to jump
Right.
through. And occasionally it's very difficult to find a local interpreter. Occasionally you have to find an interpreter from a different state. So sometimes, like I went into a doctor's appointment and they brought in a VRI interpreter. She came on and I said, where are you from? And the interpreter said she's from Michigan. But here I am in Arizona. And in Arizona, in Tucson, we have different regional signs. So it's very tough for me to understand an interpreter from Michigan. So really the best thing would be to have an interpreter, a live interpreter from my area, be able to come into my appointments. Like I said, because those regional signs sometimes get complicated, and then it's like an accent with hearing people. So it can be very difficult that way as well.
Maybe you can get an amendment for the ADA Act and or have your local or state organizations, a government, just say, hey, you have to post a sign wherever you need that sign. And when I say I need somebody from an ADA to help me do the signing, I just point to that sign. See that? There's the regulation. Post it up there. That's what you have to have. That's what you have to have supply. So I don't have to carry it around with me. It's already posted where it should be. Just follow the law,
Well, and Ira, I'd
My
like to
2
point out-
cents.
I'd like to point out that there's been so much responsibility put on the deaf community to advocate for themselves when the healthcare systems just need to be doing a better job. One of the things that our team has been doing is we've been going to healthcare conferences, and we've been bringing different people on the Deaf Diabetes Community Advisory Board with us. And they're speaking to clinicians about what they need. And then I can talk on the back end because I'm a nurse practitioner. So I kind of understand how healthcare systems work. I can explain some of the processes that need to happen to make sure that they're providing good access to the deaf community. So when we team up together, it's been a wonderful experience for the presentations we've provided together.
That's great. All right, let's go to another question. James would like to add his thoughts to the conversation. James, go ahead.
Hi, thank you. James here in Washington, D.C. I'm a family medicine doctor with hearing loss, as well as a fellow CODA. And so I wanted to thank everybody for their insights. And so I'd like also to talk about, as we talk about building the infrastructure to support deaf patients, we have to remember it's also important to support developing and mentoring those with hearing loss to become healthcare professionals, which actually would address some of the communication issues discussed today. There's an organization that I'm part of called American Medical Professionals with Hearing Loss, AMPL. It's a nonprofit organization that advocates and mentors students with hearing loss and supporting them in their healthcare journey. So a lot of our members are physical therapists, nurses, doctors, and so I think that would be one part of supporting this issue and communications. And many of our members do use American Sign Language to communicate. So thank you very much.
Thank you for those comments. Question from Raj. I'll read his question. How could doctors prepare better, doctors, for a scheduled visit? And what would make you feel more comfortable to develop rapport with your doctor? How about that? Anybody want to? Tomiko, you have any thoughts on that? How would you let me read it again. How could doctors prepare better for a scheduled visit? You're coming for a visit. How could a doctor better prepare for a visit, or would make you feel more comfortable to develop rapport with your doctor? Maybe knowing your doctor is prepared for your visit would make you feel better.
Yes, I wish that they would. Occasionally doctors, I wish that they would have empathy. I wish they would understand where I'm coming from, that they would have compassion for us. Really, the number one top priority is just patience. Doctors just have to have a lot of patience and a lot of compassion and empathy, and also more time. It does take a little bit more time to make sure that that deaf patient truly understands what they're saying. And if maybe the deaf patient doesn't seem to fully grasp the concept, that the doctor takes the time to really explain it again and make sure that the deaf person can feel comfortable enough to ask questions. Because then that just provides such a better environment for the deaf person, instead of a doctor just sitting down and saying, hey, okay, you have diabetes, you need to do this, this, and this. And then I'm sitting there wondering what he said, I didn't understand. So if doctors could just have that connection, have that empathy, and take the time to explain things to me, then I would keep that same doctor forever. Instead, a lot of deaf people will travel to other doctors to try to figure out what's going on and try to go to a doctor who actually explains things. Occasionally, someone will give us the wrong medication because we didn't understand. So I think empathy, patience, and just taking that extra time to really connect with us, that's the kind of doctor that we need.
Well, that's a great. Go ahead, Michelle.
I just wanted to add on to Tomiko's comment. To be able to build that rapport takes time. And so sometimes we need to actually be building longer appointments. And then the one other thing I will add is that a technique called teach back, where we're asking the patient, tell us a little bit about what you're going to be doing at home, or what did you learn so far, and making sure that they're really understanding can mean so much to the patient, but it can also make sure that we're being understood as clinicians. And so really taking the time to lengthen the appointment and then using teach back is so critical.
This has been a really, really great discussion. I've learned a lot. I'm sure all of you have. I want to thank Tomiko and Michelle for taking time to talk with us. Thank you both. I also want to thank Lacey Voris and Kelsey Jansen for helping us out with interpretation. Thank you both for taking time to be with us. That was Dr. Michelle Lichtman. Excuse me. That was Dr. Michelle Lichtman, Medical Director of Intensive Diabetes Education and Support Program at the University of Utah, and Tomiko Rafiq, member of Deaf Diabetes Can Together. And if you want to see a really wonderful short film about all of this that profiled University of Utah's program, head to our website, sciencefriday.com/deafhealthcare. This is Science Friday from WNYC Studios.